Okay, so my mini lecture topic that I'll be presenting today is on various gastrointestinal issues, including nausea, vomiting, diarrhea, and constipation. It's all pretty thrilling stuff, so we might as well just dive into this right away. Here's just a little disclaimer. We have to say that this information today is really just a supplement to any other information, but you really should be reliant on your own independent study and looking for information in other sources. But this is just a good starting point to begin looking at these topics. So here's an overview of some of the drugs we'll be looking at. The nausea and vomiting drugs, we have a pretty long list here for that we're actually not going to be getting into in any more depth after this, actually. But those are very common drugs that you'll be dispensing, especially the acid suppression therapies like PPIs you'll see all the time and be dispensing those. But otherwise, for the other topics, for the gas and lactase deficiency, diarrhea, and constipation, we'll be going into more detail here during this lecture. So the first drug we'll be looking at is simethicone for treating intestinal gas. It's also called Gas-X. You can see there how it works, and with the way it works, it's actually not preventing the formation of gas, it's really just making it less severe. And there's the dose there. It's taken as needed after meals and at bedtime. Usually pretty well tolerated. It's not going to cause people too many problems. Pregnancy category is C, so probably should be avoided usually in that situation. However, it is safe in lactation. The next drug then is alpha-galactosidase, or Beano. I'm sure you've seen ads for it on TV. I know I've seen plenty of commercials for it. How this one works is by hydrolyzing oligosaccharides before they can be metabolized by bacteria in the colon. So by metabolizing these oligosaccharides, that's preventing the gas that normally is made when bacteria are performing that action. So this is useful in preventing gas if you're going to be eating the types of foods that would be causing gas. So, eating foods that are high in oligosaccharides, so beans and things of that nature. So it can be in forms of drops or in tablets. They'd be taken right at the beginning of the meal or right before it. It can be added into the food too, just if food's going to be cooked to a high temperature, then it shouldn't be added until after it's been cooked because it would inactivate the drug. And it should be avoided in children and pregnant and nursing women, just because there's really not good data on the effects of it in those populations. Okay, so the enzyme lactase is really just substituting the enzyme in people that are just don't naturally produce it. Otherwise, it's a normal enzyme people produce that will hydrolyze lactose into being just glucose and galactose, which your body knows how to handle and can absorb, but not everyone produces lactase naturally, so when they don't, we supply it to them. It can also cause some gas and diarrhea when this enzyme is lacking. It can come in various different products, as you can see there, and even in some dairy products it comes made right into it. So people should be taking 3 capsules of this with the first bite of any dairy product. Alright, so now we'll be moving on to the topic of diarrhea, which definition of it there with the increase in the frequency and or the fluidity of the bowel movements from normal. So it's really just a change in the bowel habits. It can have a bunch of different causes. It could be infections, it could be caused by various diseases, some foods can trigger it, and medications pretty commonly can cause it, especially antibiotics. So there are certain people that you shouldn't be recommending self-treatment with over-the-counter products for, because they may have more severe things happening and they should then see a doctor about it. And also in certain populations, it also would be inappropriate to be only recommending self-treatment. And for the note on the bottom there, it should be diarrhea lasting longer than 2 days. So if they've been having diarrhea for a long time, they really should be seeing a doctor about it. Mainstay of diarrhea treatment is just replenishing the fluids that they've been losing as they've been having this diarrhea. So it should be Pedialyte or other similar products like that. Like just giving them sports drinks or juice or soda really isn't going to work that well because it's not going to give them back the electrolytes that they've been losing while having the diarrhea. That's only going to be giving them a whole lot of sugar, so those would not be appropriate in these patients. And there you can see the dosing for it. It's a pretty wide range, not really that exact a science of how much fluid to be giving them. A lot of it's just going to be based on how much the patient's able to handle, as they just aren't going to be feeling that well as they're having all this diarrhea. Alright, a common drug you'll see for diarrhea treatments, loperamide or Imodium, as it's really just taking advantage of the opioid side effect in that it slows transit through the bowels, so in that way it's able to treat diarrhea. You can see there the indications for it. It's really for most types of diarrhea, as long as the diarrhea is not bloody at all, because that would be a sign of it being a more severe type of diarrhea that we wouldn't want to treat with this. Some effects you could get from it would be some dizziness, as it is an opioid, though normally only small concentrations of it can reach the central nervous system anyway, so normally that doesn't happen too often, but there are some populations that you should be avoiding it in, like small children and the invasive infectious disease, which really is the bloody diarrhea I was mentioning earlier. However, it is safe in pregnancy and lactation. Alright, the next drug is Pepto-Bismol. That fun pink liquid I'm sure we've all seen. It has a lot of properties that are good, in that it's coating the digestive tract, so that can help with a lot of different problems, including diarrhea, and can also be useful with nausea and things like that. It can have some adverse effects in that it can cause some neurotoxicity and it can make your ears ring. More likely would be that you'd see these other side effects, in that it's causing darkening of the tongue and stools. Not that they're looking bloody, but they're more still blackened anyway. It does have some drug interactions with warfarin and valproic acid and methotrexate, and it also does chelate some other drugs too, like tetracyclines and antacids, so being aware of those interactions and avoiding them. Another thing that some people try to use for treating diarrhea are probiotics, such as Florigen. The FDA really hasn't approved them as drugs, but there is some evidence saying they can be effective in preventing diarrhea, especially the type of diarrhea that's associated with previously taking antibiotics. And that would probably be the main time you'd be looking at using a probiotic in diarrhea. Alright, so then we'll move on to the subject of constipation, which, yeah, you can see there are various definitions for that. It kind of varies a little bit. Here we're defining as less than 3 bowel movements per week, but that's really an inexact amount. It's more just a change in the less frequent bowel movements, or having difficulty with passing bowel movements. There can be various different causes of it, like sedentary lifestyle with a lot of sitting around, not having enough fiber in the diet, or not being hydrated. It can also be caused by some medical conditions like diabetes or hypothyroid. A major cause of constipation, though, are drugs, as a lot of different drug classes can cause it, as you can see them listed there. So there are some populations where you're not going to recommend self-treatment for their constipation, particularly if they have bloody or mucousy stool, or that the symptoms have been going on for a long time, or that they are being resistant to other treatments, or if they have inflammatory bowel disease. In those situations, you'd really want to recommend that they are seeing a doctor to get treatment for their constipation. So the first class of drugs for constipation are the stool softeners. The main drug for that is docusate or Colace. It's really a surfactant, kind of a soapy liquid that will soften up the stool. It doesn't actually cause the bowel to push the stool or anything. It just can prevent constipation by softening up the stool, making it easier to pass. So if a person's already constipated, it wouldn't make sense for them to be getting docusate at all. And that drug is also safe in pregnancy. Then there are the bulk-forming agents, including psyllium or metamucil, or benefiber, Fibercon, Citracel. all fairly common agents. So they actually go into the intestines and they act kind of like fiber, really, in that they're kind of absorbing liquid and helping push the stool along that way. They have a bit of a slow onset in that they may take 12 hours up to being a day to have their effect. So they can be a decent first-line therapy if the constipation's not too acute. It is the first line for sure in pregnant and postpartum women, though. It can cause some gas or some abdominal cramping, but really the adverse effects for it aren't too bad. But it could have some interactions with some other medications, so it should separate the administration of it by an hour or two. And you can also see there that there are some cautions and contraindications of when you also might want to avoid using these agents. The next agent we'll look at is the milk of magnesia, which will draw fluid into the small intestine. And see there it has a pretty quick onset, so it's really for relieving a acute episode of constipation when you really just want to get a pretty rapid effect. So it can cause some adverse effects, as you can see there, mostly just being a matter of that it's suddenly causing quick movement to the bowels, so that's why you could be having some nausea, or that you're losing a bunch of fluid and get dehydrated. It does have a couple of cautions and contraindications, as you can see there. Another agent worth mentioning that works in a similar manner is MEG citrate, which would be used in similar situations where you're looking to get a resolution of acute constipation episode. Another class of agents for treating constipation are the hyperosmolar laxatives. So those could be glycerin and suppositories, which could be safe to use in children. Otherwise, there also is polyethylene glycol or Miralax, which would also give a pretty rapid effect. However, as you can see written there, that it's not sufficient for use as part of a bowel regimen that goes along with the use of opioid medications. The next class of agents then are the lubricants, one of those being mineral oil. So these do soften the actual fecal matter, and they also do coat and make them slipperier so that it's more easily pass through the bowels. They kind of have that intermediate onset in that range of 6 to 8 hours. So it's useful in people that need their stool to be softened and just want to not be straining to try to force out their stools. If someone's been treated for a hernia or they've recently had surgery, they don't want to be placing a lot of strain as they're going to the bathroom, so these would be appropriate for those patients. Adverse effects you normally don't see a whole lot of, only if they've been on these agents for a long time. These agents, though, do have some drug interactions in that they would decrease the absorption of some fat-soluble vitamins, as the vitamins would end up just staying within the oil and not getting absorbed by your body. There's also the potential for the effect in warfarin due to that interaction there with vitamin K. There are a couple populations to avoid using these medications in that they shouldn't be used in the elderly and not for small children or in pregnancy either. In pregnancy, you're avoiding it because it's possible that it could induce labor, so you'd want to be avoiding having that occur. Another class of agents then are the stimulant laxatives. A couple of those would be Senna or Bisacotl. They're also fairly common to see dispensed in the pharmacy. So these actually irritate the GI and are stimulating bowel movements that way. Still also a pretty intermediate onset of action. Main use of these really is in patients that are receiving opioids. They would receive these in order to prevent constipation from occurring. It also commonly is combined with docusate. So Senecot S is the combination of Senna and docusate together. So that's a very common regimen given to people on opioids. A couple of adverse effects are also noted there on the bottom that typically aren't too severe.